joining. We're gonna give it a couple more minutes and start really promptly at 6. There's a few attendees on the line, but thank you for joining us tonight for a town hall meeting hosted by Picking County Public Health around COVID-19 vaccines for children. But if you'll just sit tight, closer to that 6 o'clock time frame, I will introduce our speakers tonight, and then we'll kind of talk about the flow of this evening. So just sit tight. Thank you. For those of you joining us tonight, I'm going to give it a minute or two more just to see if we get a few more attendees on the line. Thank you for joining the Picking County Public Health sponsored Vaccine for Children Town Hall meeting. Again, I'm going to give it a couple more minutes to see if we have some more attendees join us, and then I'll walk through the list of speakers and also what you can expect for this town hall tonight. All right, because I want to be respectful of everyone's time, I am going to go ahead and kick off the town hall. Again, thank you for joining us this evening. My name is Tracy Truelove, and I'm going to facilitate the Picking County Public Health COVID vaccine town hall, vaccine for children town hall. We've held one of these before and had some really great questions and engagement come around this topic. And I'm happy to be joined tonight by 3 fabulous speakers. We're joined tonight by Carly Senst, who is the epidemiologist and COVID-19 response lead with Pitkin County Public Health, followed by Lori Cohen, who is the immunization coordinator with Community Health Services, and Dr. Rahul Shah, who is the doctor with pediatrician, or a pediatrician with Aspen Valley Primary Care. Boy, that was starting out the evening like we sometimes do. But we're happy they're all here tonight. What we're going to do for those attending, we do have the chat feature open on the webinar. So if you have questions, we will go through the presentation first. We actually have a deck with some slides even to talk through, and then I will open it up to the chat feature. We also did have a question come in ahead of this meeting that I know that Carly and I think Lori are going to tackle here later in the evening. But with that said, I'm going to open up our meeting with, I believe, Carly, you're kicking us off.
Yeah, absolutely. I want to thank everyone for coming. I look forward to kind of helping answer any questions and concerns anyone might have. To start us off, I wanted to give a quick epidemiology update and generalized COVID update, not just for Pickens County, but also sort of the state and kind of the landscape that we're currently in. So bear with me while I share my screen, pardon me. All right. So just sort of a really quick kind of recap on where are we now with COVID, what's going on in the county, what's going on at the state. And so in Pickens County in particular, we are currently looking at a plateau of our case counts and our hospitalizations, which is nice to see. That being said, we've been at the same rate of kind of getting new cases in for the last month to even 6 weeks roughly. So you can see on the two graphs on the right hand side, this is for the state as a whole. And so it's reflected as well within Pickens County's numbers. But for the top graph, you can see what those case counts were kind of from the beginning of this back in March 2020, all the way through to July 2022. And so just for reference, we have, oh my goodness, I apologize. The really big spike on the right-hand side of that graph is the Omicron surge that we saw start in November, December, and into January 2022. And you can really see sort of this plateauing at this sort of low, much lower than that peak, that Omicron peak, but still at a relatively high rate. The lower graph is just a zoom in of this this tail section, giving us a little bit more of a better read on what's going on currently. Again, at that state level, this was taken right before or right after, I should say, the holiday weekend. So that's what's contributing to this little tailed dip at the very end. But you can see it's relatively leveled off. We are kind of, we get our bumps, we get our valleys, but relatively sticking right around the same. And for us in Pickens County, that is roughly at a 200 incidence rate, level 200 incidence rate. So what that means for us as a county is that we are currently placed at the CDC's level of high community transmission risk, meaning that we have an incidence rates over 200 and that we are seeing a few hospitalizations come through. And of course, this is relative to our population. We know that our community is smaller and that many of these measures are measured at the level of 100,000. So we tend to be a bit more variable. So just as kind of an awareness, we certainly have COVID still within the community. It is around and that we are sort of seeing this changing landscape. Predominantly this plateau seems to be attributed typically to a variant that has become the dominant variant, not just within Pickens County, but within the United States. And that is BA.5. BA.5 is a sublineage of Omicron, so it is along the same familial branch. It is more transmissible and people are experiencing reinfections due to immune evasion. So this BA.5 and BA.4, if you've heard both of those, they're referenced oftentimes together, are very good at evading the way that our bodies protect us from infections or past infections. And so while it's not experiencing more transmission, it's not increasing severity of illness, you are open and it is possible for you to get a second Omicron infection with this BA.5. So it is very good at escaping that immunity, both from natural infection as well as from some of the vaccines. That being said, the vaccines do provide higher levels of protection in those neutralizing antibodies to BA.5 than a natural infection, even with a previous Omicron infection. So ultimately what that means is that vaccines are still going to provide a better level of protection than a previous infection. So we're still encouraging those vaccines. If you are not up to date on your booster, if you are eligible, may I recommend to increase that level of protection, you go receive it. We'll talk a little bit more about available vaccination clinics coming up in Pickens County a little bit later on in the talk. Testing within Pickens County has changed in the last couple weeks even. This is a very different landscape than what we were looking at even 3 months ago. And I just wanted to take this opportunity to highlight the fact that we do have a free community testing site located at the Aspen Airport cell phone parking lot. You can go ahead and check out those locations on our testing website. And you can go through, make an appointment for yourself there. So those community PCR tests are very much available. Results for those tests typically arrive anywhere from 24 to 48 hours, depending on holiday scheduling and all the rest. So testing is still available. We still have access to free PCR tests. And then obviously the at-home tests, we're seeing a huge increase in usage of. They are an incredible tool to allow community members to make good decisions for themselves and for their families. If you are not feeling well, a good at-home test can kind of clarify if you have COVID, how long you should isolate, when you should start looking at that quarantine, isolation, and exposure days. But what this means for us and our way of tracking COVID-19 within the county is the more at-home tests that are being utilized over reported PCR tests, is that our numbers are shifting and the metrics in our data that we're going to be using going forward is going to shift, just simply because those at-home tests don't get reported to us unless you choose to do so yourself. So just want to highlight that if you're tracking our data on our website, it does shift a little bit, especially now that we're seeing that high usage of those at-home testing options. Brief update on what the response looks like for Pickens County as well. Big push to prioritize at-risk populations. What this means is that the CDC and the Colorado Department of Public Health and Environment have highlighted that we are going to be doing case contacting for minors and those individuals who are 65 plus years of age. If you fall within that and still need resources, please don't hesitate to reach out to us. We are happy to connect you to resources if you need assistance with functionally anything, or if you have any questions regarding your isolation. Just because we will not be inherently reaching out to you to do the full case investigation doesn't mean that resources are not available to you. So please reach out if you have any questions and know that we are, as a team, prioritizing individuals who either haven't had a chance to get vaccinated, even though that's changing, hopefully with this conversation, and individuals who tend to be at higher risk for severe infection or possible hospitalization. We're really doing a big push for each individual taking responsibility for their own risk factors and layering their mitigation strategies that fit to their risk factors. So individuals who are healthy and want to go attend those busy concerts can take that risk on as themselves, and individuals who know that they may be at higher risk for severe infection, wearing masks, being mindful of indoor settings, being aware of indoor ventilation, that can make a massive difference in risk levels, and just generalizing and really personalizing that response to help fit each person's individual situation. And this is really going towards that big conversation about a push towards endemic. How do we live with COVID going into the future? Is that we know that this is going to be part of our lives ongoing. We know that we are going to continue to see new variants, and how best can we re-engage with our social activities, with various life choices, and all the fun activities that we'd like to do, while still being aware of our own personal risk factors and trying to protect those around us. So that's a very brief update on kind of what Pickens County is doing and where COVID is within the community. But just wanted to highlight that we are pushing that direction and that really looking for individuals to make the best choices for themselves at this time. So on to the fun stuff, on to why everyone's here. So as everyone is aware, the vaccines for our 6 months to 4-year-olds were approved last month. This is an age group that we have really been waiting for. It is the last age group to be approved for these vaccines. And so a little bit about how COVID has been operating within this age group, especially now that we can compare it to population level data coming from vaccinated and unvaccinated minors of other age groups. So 5 to 11-year-olds, as well as the 12 to 17-year-olds. So one of the myths that we tend to hear is that kids ranging from 6 months to 4 years old cannot get COVID or don't get COVID or don't get symptomatic COVID. And that is just simply not the case. So as this graph from the CDC shows, is that we have well over 2.5 million cases of COVID within this age group. And again, that just speaks to those reported tests and not any at home or over the counter testing options. And so individuals of this age group, kids of this age group, do indeed get COVID and can suffer not just symptomatic infection, but severe COVID and even hospitalization. Yes, we do see lower rates of those severe infections and symptomatic infections within this age group, but it is possible and we do see it. And 2.5 million is certainly not a small number by any means. What I also wanted to highlight in this graph, and it will kind of show up again and the next one is that we can even see how with these cases of COVID within these age groups change in relation to when certain vaccines were approved. So if we look at the December 1st, 2021, which is roughly when we started vaccinating the 5 to 11-year-olds. So this sort of light blue line that kind of falls mid-range on that Omicron peak. We can see through the trough, they line up really, really nicely. But when we start seeing this uptick in cases again, due to kind of shifting variants, we really do see that these sort of younger age groups tend to come out a little bit higher. And again, that'll become a little bit clearer in the next graph. So this is as it pertains to hospitalizations of various age groups, again, from the CDC. During the hospitalization wave, oh my goodness, during the Omicron wave, pardon me, hospitalizations of this age group do occur. We do see hospitalizations in these younger age groups. Again, they are at a much lower rate than other at-risk populations, but they do occur. And so again, that myth that individuals within these younger age groups do not suffer severe COVID infections is also just that. It is a bit of a myth. And within this graph, you can kind of see hospitalization rates per 100,000 within the population. And amongst all of them, between 6 months to 17 across the pandemic, they've been relatively and statistically very on par with each other. So when certain age groups, when all of these age groups, couldn't seek vaccination, they all experienced infection at very similar rates. Again, if we look at the December 21st, 21, roughly when the vaccines for 5 to 11-year-olds were approved, you can see this really big kind of dramatic shift in seeing the rate of infection between 6 months and 4-year-olds really spike. With this can kind of and stay much higher than previous age groups that have been able to receive a full dose of vaccine, a full series of vaccinations. What this means is that we're seeing lower rates of hospitalizations within populations of these younger age groups that have been able to be vaccinated as compared to that at-risk unvaccinated population of 6 months to 4 years old. The big takeaway from this also is that right under the September 21 date, this was kind of peak Delta wave. So that's really, we could see I remember when Delta first hit the, the big time and that really we see it that hospitalizations within 6 months to 4-year-olds is 5 times that of the Delta wave when we're looking at Omicron. And so Omicron, just based on sheer numbers, it really did take a lot of it ran through the population really heavily, is that we really saw those unvaccinated populations get hit the hardest. Again, just sort of reiterating that we are seeing hospitalizations and severe COVID within these age groups. So again, even though they make up that lower rate, we can see the continued increase, this yellow line, the 1 to 4-year-olds, are still seeing higher rates of hospitalizations than those other 2 age groups which have been able to be fully vaccinated. The flip side of this is that we can kind of see it from hospitalization data based on age group, and we can see it sort of in sort of those really big picture data sets. This study specifically looks at hospitalizations between the 5 to 11 and 12 to 17-year-olds of unvaccinated and vaccinated individuals. In both cases, we see that individuals who have not been vaccinated are hospitalized at a much higher rate. And so this is sort of one of the best proxies that we can see to the effect that the vaccinations will have on our 6 months to 4-year-olds, is that if the vaccine, which is functionally and technologically very similar and almost the same to this age group, we can assume and kind of extrapolate that to our 6 months to 4-year-olds, is that we see the impact that vaccination has on hospitalization and severe COVID within these two other age groups. We can look to that data set to tell us what the impact will be for those 6 month to 4-year-olds. The other big thing that we hear a lot about is that really, is COVID-19 any different than any other sort of vaccine preventable illness? Is it different than the flu? Is it different than all of the rest? So these two graphs look at both hospitalizations and death per year from various vaccine preventable diseases amongst different age groups, depending on the data sets that are accessible. And so we can really see that COVID really is causing a statistically significant higher rate of death and severe illness than a lot of other vaccine preventable illnesses that we have been vaccinating this age group for years, if not decades. And so it really is critical to sort of highlight the impact that COVID is having amongst this age group, and that we vaccinate for a lot of other illnesses that aren't causing a severe impact as COVID. Vaccinating for COVID just makes sense. The flip side of this also is that multisystem inflammatory syndrome is not unique to COVID, but it is a disorder and syndrome that is being strongly associated with COVID. So this is not a side effect of vaccination. So I do want to kind of make this clear, is that this is looking at a syndrome that is associated with unvaccinated individuals, in particular 6 months to 4-year-olds. And so what this is, you can read the definition on top, and it occurs roughly 2 to 6 weeks after infection with COVID-19, with the SARS-CoV-2 virus. 60 to 70% of cases are admitted to intensive care. So this isn't being admitted for COVID. This is being admitted specifically for the syndrome which develops after an individual is infected with COVID. And so the big takeaway from this is that this is something that can impact anyone, but for this age group in particular, we are looking at pretty high rates of of having this disorder, having this syndrome develop after infection with the SARS-CoV virus. And then studies have come out showing that 2 doses of Pfizer, it was just the vaccine that they utilized. There's nothing unique to Pfizer over Moderna, but it was ultimately highlighting that Pfizer, 2 doses of the Pfizer, the full primary series, is 91% effective at preventing development of this multisystem inflammatory syndrome. So the vaccine not only protects your children from COVID, but it also can help protect your kids from certain side effects or potential long-term effects of COVID infection as well. And so I just wanted to kind of flip it on its head and look at what could potentially happen to children who don't receive the vaccine, is that this is another risk factor. If kids don't get vaccinated, they could develop this syndrome potentially, and that vaccines are very, very effective at preventing it. One of the big takeaways from this, or the 3 big takeaways, is that vaccinations, while it doesn't protect your children from catching COVID, they could still develop potential symptoms. It does lower the severity of those infections and greatly reduces the likelihood of hospitalization for the child who receives the vaccine. The vaccine is also able to prevent certain secondary conditions associated with becoming infected with the SARS-CoV-2 virus. So this not only protects the individual child who receives the vaccine, but it also helps protect the family unit. I'm talking to parents who have now lived through a pandemic for more than 2 years. I understand and I know that the impact of having a sick child, not just amongst potentially other siblings, but also amongst you, can impact work, can impact their schools, and can impact those amongst the family unit who are of that higher risk category, like grandparents or other sick or immunocompromised individuals within the family. So vaccinating children not only helps protect themselves, but also protects that family unit and works towards a return to sort of a more normal process of dealing with illness within that. Larger picture even still is that reducing disease burden, particularly amongst children, helps reduce disease burden amongst the entire population, amongst the entire community. So if we reduce severity of illness, if we reduce the rate of transmission of the illness, we kind of and help protect the community as a whole, it reduces transmission across the entire county. So vaccination is not just good for the individual, it is also good for everyone around them and helps schools return to normal, helps in-person learning return to a more standardized format, and helps keep parents at work and grandparents safe, and really does kind of benefit not just the small picture, but the whole larger picture as well. I believe that one was it for me. I don't know, Tracy, if you want me to introduce Lori, but
Yeah, go ahead and reintroduce Lori. That would be great.
perfect. The next speaker is Lori Cohen. She is the immunization coordinator with Community Health Services, who is public health's partner to help manage and administer a lot of vaccines and vaccine clinics throughout the county.
Hi, everyone. Welcome. Next slide, Carly. All right. Ooh, a new slide. So pediatric COVID background. There have been over 2 million cases in children aged 6 months to 4 years. Approximately 45,000 of the kids in this age group were admitted to the hospital in the past 2 years. Let's see, around 450 children have died of COVID. Roughly 10,000 of these patients were in the pediatric ICU, and 1/3 to 1/2 of them did not have any other known medical risk factors. I know that's kind of been a thought that maybe some of these kiddos had, were predisposed to other medical conditions, but that's not quite the case. Rates for other vaccine preventable diseases are much lower, yet we still routinely attempt to protect them from those illnesses. Measles, we have about 1,000 cases per year, and flu, about 100 deaths per year. So we're looking at more with COVID. So, it's kind of important to get this vaccine going for this age group. Next slide. All right, and I'm just going to give you some basic general information about the two vaccines, both Moderna and Pfizer. A lot of this might not be new. We looked at this with our adolescent and adult vaccines. So similar to those vaccines, both Moderna and Pfizer had to go through the FDA and CDC to get approval for the pediatric vaccine. And after, they submitted their clinical trial information to the FDA. And then on June 17th, the FDA did grant the EUA, the emergency use authorization, for both Moderna and Pfizer. And then after reviewing that information from the FDA, the CDC's advisory committee then gave the official recommendation for use of both Moderna and Pfizer. Moderna for 6 months to 5 years old, and then Pfizer for 6 months through 4 years old. That was on June 18th, and the ACIP determined that the benefits of vaccine, far outweigh the risks of COVID for this population. Next slide. So safety and efficacy. In clinical trials, it was really important for both Moderna and Pfizer to determine that these vaccines for this age population were safe and effective and provided good quality. So they went through rigorous standards to, just get these vaccines approved. And these are the same processes we use for all childhood vaccines, and those have been given safely for decades. Moderna and Pfizer have specifically formulated the dosage and timing of the vaccines. They've found them to be safe, effective. They've also changed the dosing. So what we were used to as for the adult and for the adolescent range, the Pfizer is now doing 1/10 of the dosage. So 0.2 milliliters is what we're doing for a Pfizer vaccine. And then Moderna will be about 1/4, so 0.25 dose for the Moderna vaccine for the kiddos. The dosages they've determined are based on your child's immunity, your immune system, which is based on age. So, a lot of times we think maybe because they're bigger for their age, they might need a bigger dose. No, we actually want to give the dosage based on their age. Next slide. So side effects. In the clinical trials, we were seeing very similar side effects to what we saw as adults who got the vaccine, as adolescents who got the vaccine. And for this age, 6 months to 5 years, they're very similar to what we see in just regular childhood vaccinations. For those 6 to 23, so that 6-month to 2-year-old age, mostly we're seeing some irritability, some decreased appetite, maybe some fever and some swelling at the injection site. Then those same side effects were reported for the 2 to 4-year-old age. And then with them, there's also the possibility of maybe some fever, headache, and chills. I get a lot of parents asking me about myocarditis because, we were seeing that as a side effect in some of the older males. It kind of came out in the paper and the news that this was, very rare, but it occurred. What we've seen in the clinical trials for this age group is that it was not reported at all. And then actually, some of the newer reports are showing that in the 5 to 11-year-old range, there were about 20 confirmed reports of myocarditis, and that's out of 18.1 million doses that were given for Pfizer. We're only seeing that because Moderna was not given for that age range. So right now it's mostly, though rare, it is mostly seen in like 16-year-old males and older. Next slide. Looking at scheduling. So this is a little different for the kiddos for Pfizer. So we're looking at dose 1, we're giving it day 0, and then 3 weeks later, although we can stretch it to 8 weeks, based on personal preference, we do dose 2, and then we're doing a 3rd dose at least 8 weeks after the 2nd dose. And then with Moderna, very similar to what we were doing for adults, it's a 4-week interval between dose 1 and dose 2. Next slide.
Is that my cue?
Carly, do you want to go ahead and introduce Dr. Shaw?
Yeah, no, I would love to. So I just want to make sure, Lori, that you had finished. Just one thing to add sort of to the conversation about the Pfizer and Moderna is that they have suggested that Moderna is likely going to recommend a booster at some point, and that it is realistic that while in this graphic kind of, or visual, it looks like, Pfizer is going to take 3 months to get full effectiveness. It is likely that Moderna is also going to follow a similar pattern going forward. And it is likely that we're going to be looking at boosters for all age groups into the future, while that's not the case right now. And that Moderna and Pfizer on these dose schedules are both incredibly effective at keeping kiddos safe. The dose scheduling, I hope, I would like to encourage anyone not to allow that to sort of sway their choices, is that really it is, both vaccines are awesome, both vaccines are incredibly effective, and that realistically it is likely that Moderna is also going to require 3 doses at some point. And then I know, Dr. Shah, you may have, I don't know if you had any slides on your own that you would like to present, but for the pediatrician and our local representative for all things medical and kiddo, this is Dr. Rahul Shah. He is with Aspen Valley Primary Care, an MD and a pediatrician.
Thanks, Carly. I had a slide, it got tucked into Lori's, but she covered it perfectly. So I'll leave that out of it. Well, thanks, Carly and Lori. You both covered all the meat and potatoes of the subject. So I think I'm maybe here tonight as a cheerleader and just be a voice of encouragement for families in our valley. I thought I would go over some of the questions that some of my patients' families have asked me recently, and for full transparency, things that my wife and I have discussed as our baby turns 6 months at the end of this week, and we've also had conversations of how do we want to approach this. But hopefully, what I can share with you tonight is encouraging and reassuring, and addresses some of the questions. So I think in order of priority, the question that I get asked most often is it safe? And Lori and Carly covered this in great detail. There have been over 20 million doses between the different pediatric age ranges administered throughout the US, and the reported the tracking for safety monitoring has not revealed something unexpected or anything out of the ordinary compared to other routine immunizations that we give children day in and day out. So, and I think one of the ones that's naturally on the forefront of everyone's minds is the heart inflammation or myocarditis that came in the news last year. And Lori, you hit it on the head, which is there's been so few cases out of I think you just summarized 20 cases out of about 20 million. So putting us right at about a 1 in a million chance of it happening. One additional statistic that I had learned from Children's Hospital last summer was that even amongst those older teens and young adults who were diagnosed with heart inflammation, only about 10% of those patients had any changes found to their heart when pictures were taken or imaging was done to their heart. So hopefully that's also a little bit reassuring that there may have been some symptoms, but not always the full extent of disease from heart inflammation. So I think safety-wise, I feel good, and hopefully the community feels good too. Another question I get is, well, does my child even need it? Is it going to make a difference? And I think this is a harder one to sometimes imagine the hypothetical, but Carly, your graph was so informative, and I think hopefully demonstrated what I'm about to mention, which is the differences seen in the older teenagers and the younger age groups following the first round of vaccinations last year. And we saw that difference and attributed it to the fact that the vaccines did have some effect, and whether it stopped one family's child from having severe illness and another from mild illness, the gap is pretty evident on Carly's graph earlier. So I try to remind people it will make a difference, and hopefully we'll never have to know, was it a small difference or a big difference, but that there was a difference and you're making a safe and a wise choice for your child. Another question I get is, what are the side effects? And then should I be expecting anything? Lori just covered the common ones that were reported from the trials from Pfizer and Moderna. And I would say, just to keep it short and sweet, very similar to other routine vaccines: fevers, chills, sometimes some headache or muscle ache, and sometimes pain around the site of the injection. I think one thing that can happen with other routine vaccines, but doesn't get discussed necessarily every time, is the chance of some lymph node swelling or swelling of the glands near to where you get the injection. So sometimes in the groin for infants getting an injection in their thigh, other times in the armpits for the older children and teens who are getting an injection in their arm. Another question I've received is, well, how did they decide on the dose, or is this dose, safe and reasonable for such a small child or small baby? And you all just covered that just a moment ago. The Pfizer dose is about 1/10 of the adult dose, and the Moderna dose is 1/4 of the typical dose. And Lori nailed it as well. It's about the child's age and the status or maturity of their immune system, not about their size or their weight at the time of the vaccine. In fact, a big emphasis of the trial, from what I learned from the last CDC call about both vaccines, was focused on determining what is the smallest dose that achieves some minimum effectiveness of antibody response. And that's how both of the companies ended up with the sizes of dose that they landed on. I've had, of course, questions about, well, my son or my daughter already had COVID, so do they really need it anymore? And Carly actually covered this as well, which is that we've seen that there is a degree of loss of immunity over time from so-called natural infection or natural immunity. And we have seen not only in children, but in adults, in pregnant people, that those who have had the illness and have had immunization have greater protective effect following that than those who have just been infected alone or even vaccinated alone. So I suppose if your child's already had it, then this is an even extra little boost to their immunity. And for those who haven't, then they're very fortunate that you've made it this far without having to experience that. So even if your child has had COVID before, I still encourage everyone to seek vaccination. And then the last one I've gotten a number of times, especially from families with younger infants, and maybe more of a practical question, which is, can they get their COVID vaccine along with their other routine vaccines at their checkup? And the current guidance from the CDC is that it's safe to administer it together. So if you're bringing your 6-month-old, like I will be in a couple days, or your 1-year-old, and they're due for other vaccines, it's fine to give them all together. This is, I think, a very popular question in general about vaccines, and we know that you get a strong immune response from getting them together, and it's not something that maybe overwhelms the child, which I think sometimes is the fear, but the COVID vaccine is not being treated differently than what we normally do. So perfectly fine to get them all together, and you don't have to count days or weeks separating all of them. So hopefully that makes life a little easier, and hopefully give you all a little optimism going forward. And I guess the last piece I'll share in terms of being a cheerleader is I think we're all very much fatigued from this topic and this situation that's affected all of us. And so I hope that instead of feeling defeated this far out from the start of our COVID pandemic, I hope, like me, you're actually just so excited that the day is here, what you've been waiting for your young children, and just it happens to be by chance that my baby happens to be turning 6 months old just this week, that I couldn't be more relieved that this is available to us, and it's finally here.
That was a great wrap up, Dr. Shaw. Thank you very much. I want to go ahead, Carly, I think I'll see if we have anybody joining us that wants to put any questions in the chat. Give that a couple of seconds to see if that happens. And if not, I know you got a pretty loaded question that came in through the form ahead of the meeting that might be a good one that other people would like to hear about too. Actually, why don't we do that? Carly, why don't you jump to that question? And then again, folks that are joining us tonight, thank you again for joining us. If you have questions, this is a great opportunity to hit up our subject matter experts around this conversation and this topic. And if you'll just put it in the chat, we will we'll cover it there. Carly, if somebody has a question for a follow-up later, what would be a good place to have them email that information or that question?
I think especially as it pertains to COVID-19 and vaccinations and all the rest, as ever, our COVID helpline is kind of our hub and knows where all those experts are. So whether it's about testing or vaccination, feel free to shoot an email to covidhelp@pitkincounty.com. You can always also go to our Pitkin County COVID response website, which is also an excellent hub and resource for all things COVID questions and answers. There's also a phone number on that website that you can give a ring to as well. You are also more than welcome to reach out to me at carlin.sense@pitkincounty.com if you have any questions on any of the slides or any of the information presented here tonight.
Great. Why don't you touch on that question that we got in, and then I can kind of wrap it.
No, that sounds good. And so I just pulled it up. So just so the public and community knows sort of what the question is in reference to, I'd like to read it out in brief. As a parent of 2 kids under 5, I'm frustrated that there has not been a clear and robust rollout of vaccines for this age group. My kid has gotten and received their first shots, but it was challenging to figure out when, where, and how to not only schedule those, but the second doses as well. My pediatrician's office was not very helpful in being able to assist me to locate those doses. I'm concerned they won't have peer protection when they go back to school with this age group. What are the plans for beefing up the vaccination rollout for this age group and ensuring that as many children as possible are protected and protecting others? I think this question covers the gamut of a really important sort of public, concern, right? Is that the vaccine we know protects individuals, but it really is that community level protection that vaccines provide that really is critical to kind of break these chains of transmission and really reduce the impact that COVID has on community. So I appreciate this person coming through, or this individual coming through and expressing their concerns. So thank you for that. For sort of the broad rollout, this vaccine in particular has had more hurdles and bumps in the road along the way, specifically to what Lori was talking about, the rigorousness of these trials that these vaccines have to go through. And so if I remember back in the winter, we were hoping that this vaccine was going to get approved. And it went to the FDA, it got submitted, and the FDA was looking at the data and was not satisfied with it and sent it right back and said, you didn't do enough, let's try again. And so it really does speak to sort of that process, speaks to sort of the checks and balances that go towards assuring that these vaccines are safe and effective and are really meeting that burden of proof to assure that that's the case for this age group. That being said, it makes rollout and kind of notifying the public a little challenging when we thought that we were doing this 3 months ago and that we were going to receive this approval. We had this whole buildup and then it didn't happen. It gives people whiplash. And I think that it's hard to re-engage individuals once it feels like it got taken away once before. So for this time, we've really tried to focus extensively on our pediatrician and our pediatric providers within Pitkin County. We know that pediatricians are such a critical part of not only administering vaccines, obviously as healthcare providers, but also just as Dr. Shah is doing here today, helping distribute this information and helping talk to patients about some of these concerns. I think a lot of those questions you brought up, Dr. Shah, were echo a lot of what the community is feeling. And if individuals don't feel like they can go to their pediatric provider in order to sort of answer those questions, it can be really difficult to know where to navigate, where to go to for that, not just information, but also the vaccine. And so really trying to target our pediatric providers to be that hub and be that core and at that center of that care team for these families is, I think, one of the largest points of our strategic effort here. I also want to highlight that there is very much still availability for this age group and for adults and boosters and all the rest. I'm going to flash forward here via our public vaccination clinics. So as ever, you can go to the Pitkin County COVID-19 response website under the vaccine tab. That has a list of all upcoming public vaccination clinics. And so those we try to do by month. And then there's all the information that you need about what vaccines are available, how to schedule, where it's going to be. And so these are all open to the public. There is no insurance required. There's no ID required. Walk-up is possible. And we really are trying through this effort to make the vaccine as available as possible. So if you've called your pediatrician, they might not have been able to order the vaccine yet. They might not have the capacity to be able to administer it, but you are still interested in receiving it. These public clinics are the perfect spot for you and your kiddo. I have heard only great things. I'm very excited. I'm going to go visit them on the 15th. To see how they are doing with this rollout of the vaccine. So these are public. Again, anyone can go. If your pediatrician doesn't have that vaccine, please stop by the vaccination bus at any of these locations and dates and times. And just, I know that we're looking at first and primary series, so first and second doses. These are not the only dates that we will have the vaccination bus. So if you get your first dose at the bus at any of these locations and dates, they're coming back to Pitkin County in a month. And so we are very fortunate to have them as a resource. But again, feel free to reach out to your physician for any questions. You can always, again, email that COVID help email at pitkincounty.com, excuse me, or reach out to our call center and we are happy to help assist you in finding clinics, finding vaccines, and really just getting the word out there. I think the other aspect of it are public engagement sessions like this. I think it's really good to have these public discussions about these concerns and trying to get the word out. We also know that a good portion of families may be waiting to time out with family vacations, with summer camps, with after school programs, and that we recognize that realistically, no one's thinking about school vaccines right now, except us. We are thinking about school vaccines. And so looking kind of more towards that late summer, having continued availability. So just as Dr. Shah said, when you have your kiddo going in for their standard before school checkup, getting some extra vaccines, this is hopefully just going to be one of those things that falls right into line with that schedule and those appointments. So I hope that helps answers. I know there might be other.
No, that's a great, and there's actually a great question that came in about that. Do you have to be a Pickens County resident to get your vaccine at one of those locations?
No, you do not. This is open to literally anyone. The more people who are able to get vaccinated and get their doses within Pickens County and are operating in our community, the better for everyone involved. So wherever you are from, it is multilingual, multicultural. Please come by and get that vaccine at any of these spots.
Then I'll ask the question, do we have these dates up on the COVID website so that you can't remember, you haven't taken a photo of them, you could go find them on our website? Can you just remind everybody where that is?
Yeah, absolutely. If you, sorry, I just closed out. So again, even if you just go straight to Google, you can Google Pickens County COVID-19 response, that pops it right up. Even Pickens County vaccine. I think we're the first thing that comes up on Google. And so click there, and then at the top of the page, you'll even see right in front, get vaccinated, and that takes you right to all these dates. And it has scheduling information and links right below that. Again, you don't need to schedule if you're not quite sure what your day looks like then. They all accept walk-ups as well.
I don't see any more questions in chat. I do want to just shout out a thank you to the team that puts this all together, that supports this and gets us going. Again, to Lori and Dr. Shah for helping as subject matter experts tonight, but also just the Pickens County team that continues to really support the importance of this information and to do everything they can to protect our community. So unless anybody has anything else to add, I'm going to call it a night so people can continue with their evening. All right, it's looking good. For all those that joined us tonight, we really appreciate you doing that, and have a good night.